So good morning, everyone. My name is Susan Oderwald. I'm the owner of Always Best Care Senior Services. And I'm going to let my fellow panelists introduce themselves. The topic that we're going to be talking about today is how we age and what our options are as we age. I work in home care. I'm going to talk a little bit about that. Doris works in assisted living, and Danielle works with nursing homes. So we're going to basically cover that continuum of care and those options. But I want to start by letting everybody introduce themselves. Go ahead, Doris.
Hello, I'm Doris Quagliani. I'm the Executive Director of Carriage Green at Milford. We are an assisted living community located over on Plains Road in Milford. And we are an apartment building, and we bring all of your needs, your personal needs, to the privacy of your apartment.
Danielle. Thank you. Good morning, afternoon rather. Thank you all for joining us. I'm Danielle Ramos. I am with National Healthcare. National has 13 skilled nursing facilities in the state of Connecticut, so I cover our 6 in the southwestern part of the state. As I'll talk about a little later in the presentation, we provide short-term rehab, long-term care, and memory care. Our local facility here to Milford is Milford Health and Rehab, which is over on Passion.
So just by way of introduction, I think all of us would concur that a lot of families and individuals don't do a lot of research ahead of having been thrown into a situation where suddenly something changes in their lives and they need care. And I guess what I would encourage is anyone listening, all of us have friends and family members and people in our lives who are aging, is to try to be a bit proactive and do some research and understand a little bit about what options are ahead of time, what people's preferences are, some contingency planning. If this happens, we would maybe do that, but if that happens, maybe we do this. Being prepared is half the battle, because once something happens and you're in crisis or in the hospital with mom and decisions have to be made, everything is much harder on you. It's much harder on mom, and it's harder on, honestly, the service providers trying to help you if you haven't thought about some of those questions in advance. So I'm going to start off by talking a little bit about the home care industry. Home care has really changed quite a bit over the past few years. There were lots of trends in caring for people at home that were already in place before the pandemic. But the pandemic has, I would say, really accelerated people's use of technologies with and thoughts about caring for people at home versus putting them in facilities. So it's a very dynamic environment right now for home care. The first thing I want to do is differentiate. There are 2 types of care at home in broad strokes. There is medical home care, home health, which is your visiting nurse, in-home physical therapy, in-home occupational therapy. If those services are needed and prescribed by a doctor, or if you're coming out of a rehab or a hospital and they're part of your care plan and discharge plan, those services are generally covered by your health insurance or Medicare. But very often people come home and they need services above and beyond what home health will provide. So if you need an aide to be with mom 24/7 or overnights, or to come for 4 or 5 hours in the morning, that is not covered by health insurance or Medicare. That's generally just paid out of pocket, or it's covered by something called long-term care insurance. So there's medical home care, and then there's non-medical home care. And that's the type of home care that my agency provides. We basically help people at home with bathing, dressing, housekeeping, errands. It can be anything from a few hours, a few days, up to 24/7 awake care, but it is not covered by health insurance or anything else. In terms of the type of situations that people have as they age at home, the options basically are to, quote unquote, age in place. You'll hear that terminology used very often. But aging in place really means aging wherever you live. It could be in an assisted living community. It could be in a downsized condo. It could be in the home that you've lived in for the past 50 years. Obviously, if you're going to choose to age in place, regardless of where you are, you need to determine whether there's supplemental services that need to be brought in to help you do that safely, or if there's modifications to the home that you may need to make sure that you're safe in that environment as you age. Another very common option is to move in with family members, either with an in-law suite or just a room, but basically traditionally, you know, in our country especially, people do have family members take care of them. And increasingly, we're seeing things like children and grandchildren, especially move in maybe with grandma or grandpa to help with some of their care as well. But even when folks are co-located with their family members, we often find that some supplemental care while people are working or if someone's really not sleeping through the night is sometimes needed. So even if you do choose to go live with your family or family members come live with you, you may need some outside services brought in from time to time to help manage care. So those are basically the options. There are times I would say where getting care at home is not a great idea, and I really want to talk a little bit about those. Sometimes the level of care a client needs at home is just very intense. It may have some medical necessity. Non-medical home care companies, there are a whole number of restrictions of things that we are not licensed or not allowed to do in the home that only a home health company can do. And when those needs, when someone has a feeding tube or needs IV infusion, or even things like Hoyer lifts, which require two-person transfers, there are situations where the level of care can become too intense at home, and nursing care just can't be brought in on a dime. Nursing care can't be sitting there providing that care. And in those cases, it's usually prohibitively expensive or just impractical to provide care at home. The other time I would say that I wouldn't recommend care at home is if the client is particularly vulnerable. If you have someone who does not have any local family or person that's sort of there to mind the store, especially if they have dementia and their entire well-being is put into the hands of an agency or put into the hands of a privately paid individual, there's an inherent conflict there. And I think it's important that every senior, especially if they're vulnerable in some way, have family or some type of formal advocate that's minding what's going on and employing that agency and making sure that everything is going the way it should go. Sometimes the nature of someone's condition, dementia in particular, can be combative. It can be very difficult for one or two people to care for that person consistently at home. They may be better suited to be in a memory care community, which has a diversity of people on the floor at any given time, so that it's not too onerous or difficult for a one-on-one exchange in the home. And finally, I think with home care, especially now during COVID, the schedule is very important. Just like many places right now, and this was one of those things that was going on before COVID, but has really become intense during COVID and has become even more difficult during our current outbreak. You know, if the schedule is not really attractive to caregivers or is impractical for people to get to, I want 1 hour, 10 times a day with an hour in between. Nobody's going to be coming back and forth to your house. So having a schedule that's attractive to caregivers, that can be stably staffed, so you don't have a parade of caregivers coming through your home, is incredibly important. And if you can't afford that, or if you can't, if that's really not acceptable to have something different, then maybe an assisted living community or other situation would be better suited than trying to bring in outside help. And finally, I've worked with many families who are not on the same page about what the best solution for mom is. So sometimes having mom at home or dad at home can cause a lot of family anxiety or friction, especially if there's some siblings who are close by that feel that they're on deck all the time, and then there's siblings very far away who are worried and taking pot shots all the time. So sometimes the family friction can be alleviated by not having mom or dad at home, by having mom in someplace, some other type of community setting where they know somebody's with them all the time, and that there's a diversity of staff available to them and nursing available to them. So those are my initial comments about home care. I'm going to turn it over to Doris, who's going to talk about assisted living.
Thank you. Thank
You're
you.
welcome.
Thank you for sort of introducing assisted living for me. So we are, Carriage Green at Milford is, like I said earlier, it's an apartment building. We have 103 apartments. There are 79 in our traditional assisted living community, and there is 24 in our memory care. Our memory care is a secured unit to keep our residents safe. What that means are the doors are locked. And so basically we have studio apartments, 1-bedroom apartments, and 2-bedroom apartments. In traditional and in our memory care, we have studio apartments, 1-bedroom apartments, and shared apartments. The goal is for our residents to move into our community and make that their home, so that they can stay in their home till end of life. We call it, as Susan introduced it to you, is aging in place. And that is the goal. So in addition to bringing care to the privacy of your home, we also offer social activities all day. So we have included in your rent, it's an all-inclusive type of agreement. A lot of people refer to it almost like a cruise ship. So we include 3 meals a day. We have all-day dining. So in between meals, you can go down and have something to eat. We have an ice cream parlor that is open all day, mainly just for coffee, tea, snacks. But every day at 2 p.m., we scoop ice cream. And then every day at 3:30 in the afternoon, we have happy hour, where our beverages and our snacks are included in your rent as well. In addition to a lot of food, we also include housekeeping. Once a week, someone will clean the apartment. They do your linens and your towels. Every day, someone makes your bed and empties your trash. They do your personal laundry. Transportation to and from medical appointments is included. And we go as far as Fairfield for medical appointments in one direction, and as far as Brantford in the other direction for medical appointments. We also have transportation to shopping and banking on the weekends. If you make an appointment, say to go to your favorite beauty salon, you can arrange for transportation. It's convenient. You just go to the front desk and sign up for transportation. We also, pre-COVID, was going to all the churches in Milford on the weekends. So if you were religious, whatever church you belong to, we would bring you to that church. And also pre-COVID, we were doing trips once a week. We went to the casino once a month. We would go to the movie theater, Thimble Islands cruise, just trying to offer whatever social activities our residents are looking for. We have a wonderful activities director. Her name is Tony Ann. I call her Julie from the Love Boat, and she always finds things to do for our residents. In-house, we have, the traditional bingo and word games, but we also have, Wii bowling, Wii golf. We have a beautiful courtyard. We have clubs that you can join. We have book club. We have garden club. We have a men's group. We have a pool table. You can shoot pool. So we really do our best to keep our residents active. We have live entertainment twice a week. And that's all included in your rent. We also include in your rent a pendant. It's like a life alert type pendant. You press the pendant if you need assistance. But it just goes to our in-house, all our nurses and our CNAs carry a walkie, and the message goes to them, and they know that you're looking for assistance, and then they respond to the pendant. Additionally, included in your rent are your utilities. So heat, hot water, air conditioning. We do have cable TV. You do pay for cable TV, and we do not provide telephones. So we have a lot of residents come to us, I think, thinking they're going to lose their independence. But instead what happens is they actually gain their independence. They don't have to call their family when they want to go to the beauty salon, because we have a beauty salon. if they want to go to the store, they can sign up for the trip to go to the store. They can make their own choices. We have a general practice physician in the building. The APRN is in the building twice a week. We have a podiatrist. We have on-site dental, on-site x-rays, on-site blood draw. We have an audiologist. So the residents can make their own appointments. A resident can make their own doctor's appointment and sign up for us to transport them to their medical appointment. So the goal is to make it as convenient to our family members as well as take care of the residents. So for example, a lot of family members want to be with their loved one when they go to the medical appointment. The loved one struggles to get the resident in and out of their car, whatever the reason is, they can just meet them at the medical appointment. So we do everything we can to make things simple for the family as well. We also allow pets, and we've had many residents that have come to our community that waited until their pet either passed away or someone else adopted the pet because they thought that they couldn't come with the pet. But you can have a pet at Carriage Green. We prefer that it's a small pet. We try not to have large pets. And we do need that you to be able to care for the pet. As far as staffing, we have an RN that's available 24/7. We have certified nursing assistants in the building 24/7. We have LPNs in the building every day from 6 a.m. until 10 p.m. And we have an RN that's physically in the building every day from 9 a.m. until about 6 p.m. So there's plenty of staff. We have a full dining team, a full housekeeping team. We have our own maintenance team. We have an activities team. And then we have a separate department, which is memory care. They have their own activities team, and their staff is trained specifically in memory care. Let's see. As far as the care capabilities that Susan started talking about, we as an assisted living, we have very high care capabilities. So many assisted livings don't allow things like a two-person assist or a Hoyer. We do allow that. We have residents that come in completely independent. They still drive, they babysit for their grandchildren. And then we have residents that come to us, but we are full care. We do everything for them. You know, we dress them, we feed them, we move them with a Hoyer, as Susan mentioned, from point A to point B. So we have very high medical capabilities. And the process to move in is we make it very simple. You know, there's very few steps. You come in, you take a tour, you pick out an apartment, and from there we send an RN. They can go to your home to do an assessment, to determine what your care needs are. From that, we develop a personal service plan, and then you come in and sign a lease, and the apartment is all yours, and you're ready to go. So I think that's all I need to say about assisted living. I am going to pass it over to Danielle.
Thank you.
Danielle, it's all yours.
Wonderful, thank you. So I'm going to talk to you about the skilled nursing component, which is sometimes the last piece of this continuum we're discussing. But as I'll mention at the end, it can also perhaps be the first piece, the second piece. You can move throughout this continuum. It's not a definite 1, 2, 3, or 1, 2, 3. So that's something that you'll see once you learn about my component a bit more. So as I mentioned, skilled nursing has a few components to it. One is short-term rehabilitation. Next is long-term care. Memory care is one, and also respite care. So I'm going to talk about those 4 components, all provided within the skilled nursing setting. So when it comes to short-term rehabilitation, it's exactly as it seems. It is a short-term rehab stay. So this is post-acute illness, post-hospitalization, post-surgery, whether it was elective or an emergent surgery. It's someone who no longer requires the acute care of a hospital setting, but is not well enough to go home independently. So they would come to a short-term rehab, to a skilled nursing facility for a short stay. While there, they would receive that 24/7 post-acute nursing care. We have nursing staff on site in the building 24 hours, 7 days a week. They would also receive therapy, so that would include physical, occupational, and speech therapy. It could include On admission within those first 24 hours, that person's getting assessed on every level, nursing care needs, activity of daily living needs, and therapy needs. So whatever services are provided, a plan will be put in place. Short-term rehab stay can range from days, 2 weeks, 2 months. Honestly, it depends on that person. It depends on what they're coming to us for, what comorbidities they might have. Average length of stay, I would say, is around 20 days for someone coming in for short-term rehab. Is governed by insurance in some cases. And then when that person is ready to transition back home, whether home is home with assistance, home is assisted living, wherever home may be, we can do a home evaluation where a therapy team would go into the home to see what safety measures might need to be put in place. Do home adaptations need to be made? Perhaps that person needs some grab bars in the bathroom, or a chairlift, whatever the case may be. We can assess that. So that's a short-term stay. Another component of skilled nursing is long-term care. So this is someone who is coming to live with us long-term. Their care needs have progressed to where they need that 24-hour skilled post-acute setting. So again, includes 24/7 nursing care. We provide for all activities of daily living at whatever level that person may be. As Doris mentioned, similarly, we can provide very little to very extensive care. So someone might be completely bedbound and might need to help with toileting, with eating, with dressing, with bathing, all of those needs. Or someone might be living with us and they might require only queuing. Maybe we have to just set them up with their clothing and set them up with their meals, and they're able to do the rest on their own. Whatever place that person is at, that care is all provided. Again, we have a daily rate that includes whatever that person needs. And as those care needs progress, we just provide whatever care is needed. There's no additional cost or anything of that nature. We also have daily housekeeping, daily laundry, maintenance services on site. We have daily recreation activities, so 7 days a week we are providing activities which are so important for quality of life. We're not just trying to prolong quantity. We certainly want to provide our residents who are residing with us with the highest quality of life possible. We have daily meals, snacks, recreation activities often involve a lot of snacks and fun things. We also offer more toward end-of-life hospice and palliative care in the building. The next component I want to talk to you about is memory care. So not all skilled nursing facilities have a dedicated memory care neighborhood. Some do. If a facility does not have a dedicated memory care, they very likely have the capability of safely caring for your loved one. There are safety measures in place. There are WanderGuard systems that can ensure a resident's safety. That said, for those with diagnosis of some type of dementia, a memory care neighborhood is generally the best option for them. It's secure, it's protected, it's much more structured. There's structure to the day. There's specialized programming specifically for those with memory deficits. Caregiver continuity is a big piece of a memory care neighborhood. So there's familiarity between caregiver and patient, which is helpful on many levels. Also, with a dedicated memory care neighborhood, there is, with that consistent staffing, is continual training, continual education, specifically on dementia and related, cognitive impairments. But a memory care neighborhood is definitely beneficial for someone who has some cognitive deficits. Lastly, I want to talk about respite care. Respite care is very important, especially right now with COVID and with the added stress and strain. Respite care is for caregivers. It allows them time off without worry. So they are able to place their loved one in a skilled setting. It can be for days, it can be for weeks. Again, there's generally no minimum stay. We don't have a minimum required. Some facilities may. But under the respite care program, someone's loved one would get all of the care that I've described, that 24-hour nursing oversight, meals, everything that's needed, any care that's needed, they would receive for one daily rate. Generally, it is a reduced daily rate. It's a special respite care rate. Respite is not often covered by any type of insurance, so it's generally a private pay service, but it's so critically important for caregivers, whether that caregiver simply needs a break, whether they need to travel, or they would like to travel, if they have a care need of their own, that perhaps they need a surgery and they're not able to be the primary caregiver for their loved one. Respite care is something that is extremely important for the well-being of caregivers. You have to care for yourself before you can care for someone else. So respite care is something that is also offered in the skilled nursing setting. So in terms of clinical capabilities, as I mentioned, it is a post-acute setting. So we're a step down from a hospital. There is not much that we can't do on site. So we can manage IVs in terms of antibiotics, medications. We can provide artificial hydration and nutrition. We have wound management. We have wound doctors that are coming in and managing wounds. We have pain management. We have trach management, so someone with either a new or an existing trach, we can provide that constant sectioning those requirements. We have cardiac program, pulmonary programs, respiratory therapy programs. So there's so much on site that we're able to do. Much of this, by the nursing staff. We also are able to bring in community doctors and specialists that round. So for example, cardiologists coming in to round in on patients who have some cardiac issues, which is extremely helpful. It avoids that person having to go out to a lengthy appointment or provide transportation to the appointment. So it's very beneficial to have those specialists coming into the building and rounding. We do provide services, audiology, podiatry, all of that. Phlebotomy can come into the building and really do whatever is needed for that person in our care. Lastly, I do want to bring up the notion of how are you paying for skilled nursing care? Yes, skilled nursing care is expensive. I think healthcare in general is expensive. Skilled nursing is, you're looking at upwards on average of $500 a day. So it is very costly. There are many means of payment for that. So of course, private payment is an option. Private insurance plans, commercial insurance plans, long-term care insurance will also be accepted in the skilled nursing setting, in addition to Medicare and Medicaid. So there are many options that make being in a skilled nursing setting much more feasible. On the whole, I think it's that kind of sums up skilled nursing. As I mentioned, you can move anywhere within this continuum. So we might have someone who maybe had a fall at home and went to the hospital and post-surgery needed some acute rehab, but that person is able to get back to their baseline and return home. They might need a little bit of services at home from Sue, or perhaps that person, might decide, what, I'm improved and I don't need a skilled nursing. I don't need that extensive care, but I'm not really comfortable being home alone. So an option like an assisted living is a really great alternative. So certainly, people move throughout the continuum. All of us are here to help and to provide as much information as possible. If you don't need skilled nursing, then I can direct you to another avenue that might be most beneficial for you.
I think that's true for all of us. And I just want to say one word about costs. I think there's a big misnomer out there that care at home is less expensive to people than care at an assisted living or even a skilled facility. And that's absolutely not true. The care cost, if your care needs are minimal and you only need a few hours a day, it might make economic sense to be at home. But once your care costs are sort of crossing the 10, 11, 12-hour a day, 7-day-a-week mark, at that point, the care cost becomes very comparable or even more expensive than the total cost of being in assisted living. And you got to remember, you're not just paying for people to come in, You're also still paying your utilities. You're still paying all your property insurance. You're still paying someone to do the gutters and someone to remove the snow. And when you compile all those costs together, at some point, it absolutely makes more economic sense to perhaps be in an assisted living community. I can tell you, for folks who need 24-hour awake care, a caregiver with them and awake, ready to assist 24 hours a day in their home, is far more expensive. It costs $750 a day. It's as expensive, maybe even more expensive than being in a skilled setting. So depending on the length of time that someone may have those requirements, whether it's chronic or it's a short-term period, depending on whether there is long-term care insurance in place that helps to cover some of those costs. Some veteran programs help cover some of those costs. But don't make the assumption that staying at home is cheaper. It's absolutely not necessarily cheaper. It depends really on the need, on who's living in the home, on how much care is provided, and a range of other factors. So it's important to actually sit down and work that out as your needs become more and more acute and you need more and more help. I encourage people always to make sure they're doing the right thing that they want to do, but also understand the economic implications. And because, it's not uncommon for people to spend almost $500,000 for the last 2 or 3 years of life, because the care needs can be so expensive. So it's really, really important to kind of, as I said at the beginning, before the crisis is upon you, to have some discussions, to talk with family members openly about what they're looking to do, what their plans are, do some research and do some contingency planning. If this happens, then we're going to do this. If that happens, then maybe we'll do that. Under what conditions, Mom, would you agree not to be at home anymore? Those kinds of conversations had earlier in time, not in the midst of a crisis, always go a long way.
So on that note, there are a couple of questions.
Okay, sure, absolutely.
So people are actually watching.
Yeah.
So the first question that was asked is, can you give advice on how to convince a loved one who cannot safely live at home alone anymore, but refuses to leave the home? I'm going to start.
Yeah, so I have this is a very common thing, and again, it kind of goes to having these conversations sooner rather than later, and really saying, Mom, under what conditions would you be safe here, and what conditions would you agree to leave? But if you haven't had that, or you're in the midst of that crisis and Mom or Dad is adamant about staying home, the first thing I recommend is to not get into difficult, adversarial conversations. It's really important to remind yourself and to remind your parents or your aunt or uncle that you're on their side, that you're with them in this together, that we have problems we have to face, and we're going to make those decisions together, but we have to face those problems. Secondly, if you are in a hospital setting or in a nursing home setting, or even if you have skilled nursing medical care at home through a visiting nurse, don't neglect to take advantage of the social workers that are available in that process. So all of those places have usually social workers on staff who can help have those conversations. Sometimes Mom or Dad hearing that from someone who's not their child can make a big difference in how the conversation goes. You can sit on the same side of the table as your parents, metaphorically and physically, and listen to what the social worker is saying, ask a lot of questions on your mom's behalf, and then try to see where the conversation goes. So that way, maybe the social worker is a little more of the quote unquote bad guy, and you can be a little more of the quote unquote good guy. But I also have to remind folks a lot of the time that I'm sure there were decisions they made in life that their parents didn't agree with. And their parents, if they really are capable of making their own decisions, have the right to make bad ones or ones that maybe you don't want. And then we just have to be along for the ride as they maybe make some poor decisions, end up back in the emergency room, back home, and those hot conversations start to really prove out that Mom living alone is not an option here anymore. So patience, you're on their side. Everything comes from a place of love. Mom, I'm on your side, but we can't ignore the reality of what's happening here.
Doris, any advice?
Yeah, I would just offer the suggestion that, you know, if you're considering assisted living, is that the kids, the family, does a lot of legwork before you involve mom or dad. And so that you could speak to, you know, your experience with them before bringing them, but also you can narrow it down
Yeah.
to maybe one or two choices. So, because it's overwhelming. I mean, there's a lot of assisted livings out there and we're all somewhat similar, but also very different. And you know what your parents are maybe comfortable with or looking for. So my advice would be do that legwork and then introduce the idea to them, and so you could speak confidently to them about maybe the one or two that you've narrowed it down to, and then involve them in the decision. That's my only suggestion.
Danielle, do you want to add anything to that?
No, I agree. Just every transition, I've said every transition is going to be difficult. So it might be a little bumpy, and you know, at the end of the day, what needs to happen will happen, and to make sure that everyone involved is safe. And transitions are difficult, whether it's to skilled nursing, whether it's to assisted living, even accepting care in the home for some can be very
It's very difficult, yeah.
But that too shall pass. And in time, I think, you know, that person does realize, okay, maybe this is best for me. It becomes a relief many times. And so there will be a little transitional period. It's going to be rough. It's going to be rocky, but it will pass.
The only final thing I would add on that is if you're in a situation where you really feel your parent is unsafe and in jeopardy, physical jeopardy at home, and you cannot help them help themselves, it is, I think, appropriate on occasion to call Adult Protective Services in the state of Connecticut and get them involved and talk directly with your parent. I wouldn't do that unless you're really looking at a case of self-neglect, you know, self-harm. You don't want to bring the state in, you know, for willy-nilly things. But if you really are in a terrible place and you're really worried about the physical safety of your parent, don't be afraid to involve either the health department in whatever town you live in can provide support sometimes and resources, or the state has additional resources. If they're a veteran, they have resources as well. So there's some other places if you're really in something dire.
Okay, thank you. I have two questions I'm going to kind of combine into one, and these are more for Doris and Danielle. Do you have younger brain injury people in your memory area, and are there memory care facilities available that provide brain injury specific care? I'm not anybody who knows what that means, but.
So I can answer, we do not have brain injury specific care, but we have had residents with brain injury.
Okay.
When they say younger, I'm not really sure what that means, but we have had as young as 61 in our community. So it would depend on what they're referring to as younger. But yes, so we've had brain injury care, but we don't have a specific program for that.
Okay. And Danielle, your facilities, do you have?
I agree. I think it's you know, there's a broad spectrum. We have people within our memory care who are 65 years old, who are on the earlier onset spectrum versus those who are 90. So I think, you know, the person definitely, the family member needs to do their research. There are some facilities that might have a larger population of an earlier onset or a, you know, earlier onset memory issue versus an older population. So certainly look around, do your research. Our population spans a pretty large age group, so I wouldn't say that we specifically have a.
But do you
earlier
specifically
onset.
work with dementia patients or somebody who's had an actual injury? Okay.
Both.
Yeah.
We can dementia, yeah.
Brain
So
injury,
the
yeah.
same
Brain injury,
symptoms
yeah.
go across the
Yeah.
board, and you can help them either
Yes.
way.
Yeah, very often the presentation on brain injury is very similar to dementia.
Okay. Well, I think we got to all the questions there. So I just want to say thank you all for coming.
Thank you.
Thanks for having us.
Thanks
You
for
did
having
a
us.
beautiful
Our
job
pleasure.
today.
Yeah.
Not as beautiful situation as I was hoping for, but I think it worked out. So, so thank you for being here, and we will see everybody again next month when we do another presentation.
Great,
So
thank
thank
you.
you.
Bye-bye.
Bye.
Take care.